I'm Dr. Richard Canner. I'm a professor of internal medicine in the Division of Pulmonary Medicine at the University of Utah. A dozen or so years ago, I was chairman of the state's Air Quality Board. But I'm here to talk about the health effects and what global warming is going to do to the health effects of the people of Utah. And if you increase climate temperatures, you actually will increase air pollution, and you'll get more disease from air pollution, disease temperature related because of heat, and depending on what happens to precipitation, if the area dries up, you can get dust blown off the West Desert, which contains a lot of various toxic substances, or if it becomes wetter, you may get more vector-borne diseases, and you can even maybe see malaria, and well, we have West Nile fever and others in the area. Now let's start with ozone. Ozone is a strong oxidizing agent. And by that, what I mean by that is that ozone is O3. It's 3 oxygen atoms. Normally, oxygen in the environment is O2. 2 oxygen atoms. So the third atom more readily will come off and attach itself to something. And it will combine with organic tissues and can damage them. It can combine with the rubber on your tires, causing little cracks. On plastics, you'll see the plastic begin to crumble over the years. And so these are called oxidation reactions. And one of the theories of aging is that oxidation reactions in the body gradually breaks down the various parts of our body until there's nothing left of us. So that if you have increases in the amount of ozone, potentially you can accelerate the aging process. Ozone affects crops. It affects the plant roots, the plants. It can damage agriculture. And as I say, various inorganic substances can be damaged by oxidation reactions. Now, the ozone occurs in the environment at low levels here by complex reactions that are not fully understood. But there's a mix of the oxygen in the air, volatile organic compounds, such as what comes out of your auto exhausts, oil refineries, and there are even some natural ones from plants, oxides of nitrogen, heat and sunlight. And together, somehow, this creates ozone. And the chemists, the atmospheric chemists tell me they still don't understand fully how it occurs, but it does occur. And heat is one of the things that's responsible for the development of ozone. Now, ozone has an impact on human health. And the impact is linear, which means that for so much increase in ozone, in other words, for every 100 parts per billion increase in ozone, you get so much of an increase in hospital admissions, mortality, and so forth. And there's no threshold below which you're safe. Either you're it gets worse the higher the ozone levels. And there's been many studies, and the most recent one actually was done by Arden Pope at Brigham Young University. Arden is one of the nation's preeminent investigators in the health effects of air pollution. And he clearly showed this effect with rising ozone levels, hospitalizations and mortality go up in a linear fashion. Ozone also has an interesting effect on people. If you were to take a bunch of healthy people and measure their lung function in a clean environment, then they go out and they're outdoors on a day when ozone levels are high, and you repeat their lung function measurements, their measurements go down, lung function diminishes. But if they stay outside the following day when ozone is still high, their function returns to normal. Well, your first impulse may say, well, the body's overcome the adverse effects. But actually, this is probably a bad thing, because the drop in function on the initial exposure probably helps to keep ozone out of the body, or at least minimize its effects. And when the ozone overcomes that effect, it's now able to get in and do damage. Ozone also is a greenhouse gas, so in a way it becomes a self-perpetuating cycle. The heat will create more ozone will create more heat. In addition, by damaging plant life, and especially trees, it increases the amount of carbon dioxide in the environment, because plants, and especially trees, will take carbon dioxide from the environment and use it to grow branches, leaves, etc. So again, this becomes a cycle where we get more heat from more CO2, which means the plants are less able to remove the CO2. And we always think of ozone as a summer phenomenon, but we're beginning to see it now in the winter in the energy developing areas of Wyoming and Colorado, where you have a lot of volatile organic compounds from methane gas, petroleum distillates, and so forth. And they're beginning to see that now in the wintertime. And in this past spring, we were starting to get elevations of ozone level long before we used to see, where we used to only see it during the heat of the summer. Now, ozone also can be transported long distances. You know, some of our air pollution here comes from volcanoes overseas, from forest fires in Alaska, from coal-fired plants in China, and so forth. Ozone probably travels even better in a clump together, too, than particulate air pollution. And it's my understanding that the ozone that we build up during the day here in the summertime goes out over the Salt Lake at night and then comes back the next day in the sunlight. But it can keep moving. Our ozone can hit Denver, just as the ozone from Los Angeles maybe comes to get us. So the world is totally interconnected when it comes to these various air pollutants. Now, there's also a relationship between temperature and morbidity and mortality just from heat effects. In the summer of 2003, there was a terrible heat wave in Europe, and something like 70,000 people died over just a few weeks' period of time. Now, as the Earth heats up, we're going to be see more of this. Now, Utah also, in a way, is in the cockpit for this, because Utah or the Intermountain West is predicted to be one of those areas that will get relatively warmer with respect to the rest of the planet. The polar areas, I believe, are supposed to warm up the most, but Utah, or the Intermountain West, is one of the areas that's going to be higher than some other areas. And so again, we will be at high risk for heat-related illness. And the fact that we live in cities where you don't have a lot of trees and ground to absorb some of the heat, we're outside, it's hotter here, we're at a greater risk. It's a so-called heat island. And this primarily affects older people, and since that includes me, I worry about it. So anyway, we have to worry in terms of health for multiple things. With increasing temperatures, we have to worry about vector-borne diseases. We have to worry about health effects of air pollution, health effects of toxic materials that can blow off the desert. We have to worry about heat itself as a factor which is will adversely affect human health. Thank you.